my name's Cameron Hagen. I'm a PA student here at the clinic. I'll be helping out with your exam today. Can you tell me your full name and date of birth?
Megan Griffith, 9/17/2000.
Okay, perfect. Do I have your consent for this exam today?
Yeah.
Perfect. All right, let's get started. So like I said, I'm a PA student here at the clinic. I'll be helping out. So I hear we're talking about your sleep today, right? You've been having some difficulty sleep?
I have.
Okay. So just want you to know this is a safe space. There's no judgment. I'm here to listen. And we can figure out the best steps together. So can you just start out by telling me about your sleep, like your routine and habits? What does a typical night look like for you? Like what time do you go to bed? Are you waking up when you're sleeping? Are you having trouble falling asleep, staying asleep?
Yeah, so like at night, I usually go to bed around, I try to go to bed at like 9-10 o'clock. Sometimes I have trouble falling asleep, but my real problem is waking up in the middle of the night. Sometimes I like wake up gasping for air. And yeah, I get probably around 7-8 hours of sleep a night, but I'm still really tired throughout the day.
Okay. So you said you wake up in the middle of the night, like gasping for air.
Mm-hmm.
You wake up feeling tired still, even after a full night's sleep.
Mm-hmm.
Do you feel like you're dozing off during the day, like during class or driving or during work?
Yeah, I get pretty tired.
Okay. And has anyone ever mentioned to you that you snore at all?
Yeah, my ex-boyfriend told me I snore.
And how's your energy level been lately, like physically and emotionally?
I've been pretty exhausted, both.
Yeah, so that's normal if your sleep's disrupted, right? It can affect mood, concentration. Have you noticed like any increased anxiety or stress or like a low mood at all?
I've been really stressed, really stressed, and I feel pretty anxious throughout the day.
Okay, what's making you stressed right now? Is it like work, school, relationships?
Probably school. School's a big stressor.
Okay. All right, so it sounds like you may have something like a sleep apnea, and I'll explain more of that later, but to actually like further assess if you have it or not, I'm going to ask you a few quick yes or no questions using this tool called Stop Bang. Would that be okay?
Yeah.
Okay. So first symptom is snoring, which we already talked about. I know you said you do snore, but do you snore loudly, like that people can hear it, say your parents or your ex-boyfriend can hear it through the door, or just kind of quietly?
I don't know if it's through the door, but it's pretty loud.
Okay.
Yeah.
And then you already mentioned that you kind of feel tired, fatigued, sleepy during the day, right?
Mm-hmm.
And even after a full night's sleep, so we got that one. And you already told me that you have woken up in the middle of the night gasping for air, so that's positive there. For blood pressure, have you had your blood pressure checked recently? Are you on blood pressure medication?
Yeah, every time I go to the doctor, they tell me it's a little high.
Okay.
I'm not on medicine or anything, but
Okay. Do you know what your average blood pressure kind of is?
probably like 136/80,
Okay.
something.
Okay.
Somewhere in there.
We'll assess that more at the end of the visit too, and maybe manage that. BMI, do you keep like an accurate like log of your weight? Do you know your average BMI?
Not really.
Okay, we can calculate that too. What is your height and weight? Let me just calculate it.
I'm 5'4" and around 250.
Okay. All right. And then, have you ever had your neck circumference measured?
I actually have.
Yeah?
For a special shirt I was wearing, so it's around 17 inches.
Okay. And then you were assigned female at birth, is that correct?
Yeah.
Okay. All right, so that was actually the end of the Stop Bang assessment. It went a little quicker since we knew some of the answers already. So based on your response, it looks like you are probably at risk or having slight obstructive sleep apnea. And so doing a sleep study might be a good next step, and I'll explain more about that in a second here. And like I said, obstructive sleep apnea just means that your airway relaxes a little bit too much when you sleep. So it causes you to briefly stop breathing, which sounds like you're having multiple times during the night, and then leads to poor quality sleep, which, like you said, it feels like you wake up tired, you have some daytime fatigue, maybe some mood or memory issues. It's actually really, really common, and it's very treatable once we catch it. So you came in early, so that was the first step. So like I said, I do think a sleep study might be beneficial to get some more information. It'll kind of assess severity, and then where we'll go with treatment from there. We can even work with someone like a sleep specialist too. So if you were diagnosed with a sleep study with sleep apnea, the most common treatment is called a CPAP. Have you ever heard of a CPAP before?
I think I have.
Okay. It stands for Continuous Positive Pressure Airway. So it's essentially a mask that you wear all night while sleeping, and it just helps you breathe. It sounds kind of intimidating because it's like this kind of bigger, noisy-ish machine. You have something on your mask, so if you're claustrophobic, patients are a little hesitant at first, but if you start using it consistently, I think you'll get really, really good results. And also remember things like lifestyle changes. Are you pretty active? Do you eat a well-balanced diet?
No.
Avoiding things like alcohol before bed, adjusting your sleep position are things that people don't really think about, but actually make a really big difference. Things that might affect how we move forward are things like insurance coverage, transportation, and just if you're comfortable using a CPAP. Do you have any hesitations or issues with insurance or transportation?
I think it should be okay. I don't know much about my insurance, but I can take the bus to come.
Okay. I'll have the girls up front look more into your insurance coverage too, so we're not getting into something that they're not going to cover. And then transportation, you said you take the bus here, and that usually goes smoothly for you.
Yeah, it goes okay unless it's running late, but
Okay.
I should be able to make it.
Okay. And you are comfortable using a CPAP device at home if we were to give you one? Okay.
Yeah.
Did you say that you have like a stable home environment, like you feel safe at home? It's okay.
Yeah.
And then cultural beliefs and family support can play a big role in this too. Some people don't really think about that aspect. But maybe something like not prioritizing sleep. Have you ever had conversations about sleep or health with your family?
No.
Let's talk about, okay. Okay. So like I said, sleep apnea can for sure affect your day-to-day life. You know, it seems like you're tired all day, you're not like maximizing your full potential. So sometimes a lot of patients feel like frustrated or embarrassed about snoring or using a CPAP. But if you're feeling overwhelmed or stressed about managing this, we can talk more about coping strategies. Is that more something you'd want to talk about, like seeing a therapist maybe?
Yeah, that might be a good idea.
Okay. I will put in a referral for that for you. And then just to kind of wrap up, so we're gonna go ahead and order that sleep study. Is that okay? And then while we wait on that, I'd recommend just keeping a sleep journal. So jot down what time you go to bed. If you're just laying there, maybe get up and then write that down. How many times you're waking up during the night, what time you wake up, how you wake up feeling, and then kind of note throughout the day, like getting tired by 10, feeling more energized by noon, and just try to be as more detailed as you can. And also make sure to write down like what you ate and then your like level of activity that day, so we can all correlate. And then like you said, you were interested in the therapist, so we'll get that referral in. But that is all I really have for you. I know talking about sleep and mental health can be vulnerable, so I appreciate your trust in me, and we'll take this one step at a time and we'll get you sleeping better, okay?
All right, sounds great.
Awesome.
Thank you so much.
Thanks, Megan. All right, so for the reflection portion of this assignment, during the interview, I really tried to make the patient feel comfortable by introducing myself, explaining why I was there, who I was, and asking for her consent or permission before starting the visit. I used open-ended questions like, how have you been sleeping? Tell me about your sleep habits, sleep routine, tell me about your lifestyle, diet, things like that, and let her formulate her own answers without being like kind of persuaded one way. And then I made sure to actively listen by like nodding my head, making eye contact, repeating back what she said to me so that she knew I was really listening. I also tried to make sure I wasn't using any crazy medical words that she couldn't understand, just keeping the conversation natural. Um, and then I didn't want to like tell her to change her lifestyle like I was her parent. So instead, I kind of just offered like, hey, lifestyle suggestions, diet, nutrition all play a part of this. And then maybe seeing like a nutritionist or something would help. And not just saying, hey, you need to start exercising. Hey, you need to stop eating this and that and the other thing. And then to keep the patient involved in the plan, I explained what sleep apnea was in the first place, why it matters to her health, what testing would look like, what treatment would look like, explain the CPAP, explain the C study in a way that felt like approachable, um, and made sure it was realistic for her in terms of if she has insurance, and then if she had adequate transportation, and if she even wanted to do something about it in the first place, and so that she could really help shape the plan. Um, if I could improve on something during the interview, I guess maybe digging deeper into like the stress and mental health factors that she said that could be contributing to this. And then I could maybe use like visuals to explain here's what a CPAP looks like. Because I was trying to explain it and I was using my hands. Like this is the mask, this is the device. Maybe just using visuals, showing her a video of a patient using one, just to make things clearer. And overall, the experience reminded me how like behavioral and social factors do affect your health and sleep and lifestyle, and why just having these patient-centered, open conversations um, are important, and making sure that all of our patients are as happy and healthy and well rested and well um, fed as we possibly can, and just making sure that they're educated about their health and that we are just there to help them and be a resource and to support them in any way we can. Um, yeah.